More on this healthcare debate. We get the view from both sides of the aisle here on Fox Business.
We actually, unfortunately, there's a vote taking place right now, so we're only going to be able to get one side of the aisle, the Republican side. Congressman Steve King of Iowa is joining us. Hopefully, before the hour is out, we will get our Democratic representative as well with us. But Steve King, we thank you very much for taking the time to talk to us about it. I want to start first on a compromise element, which both sides of the aisle seem to somewhat agree on. In fact, it's being put forth by Democrats, and some Republicans have said it's good. That's this co-op plan, a sort of a voluntary cooperative in order to get the best deal from healthcare providers. Explain how this works and what its chances are of passing in Congress.
I haven't had an opportunity to evaluate the proposal of a voluntary co-op, but I will just submit that into that philosophy needs to fit the philosophy of the president that they want to set up a competing insurance policy that will compete with the 1,300 and some private health insurance programs, companies that we have in America. If government comes in and subsidizes health care and it's a competing entity, then it will just naturally outcompete and atrophy the private sector, and we'll end up with a government policy. That's my number one concern, is I don't want nationalized health care. I don't want socialized medicine. I want people to have their doctor-patient relationship. I want to be able to reduce the litigation costs that increase the medical malpractice premiums across America, and keep those relationships doctor-patient and be able to have competition. When we've shown competition, it's helped keep prices down.
Okay, so let's flip it then to something that I'm sure you've been looking at as well, Representative, and that would be the insurance companies. There's a lot of concern on behalf of their people that this might edge them out somehow and that it would only be available for the wealthy. Let's dispel what we don't know. Let's put in what we do know about that.
Well, I think that, as I said, when the federal government sets up a competing operation, for example, Medicare, the only thing that you have beyond Medicare is supplemental insurance because the government has taken over the field. And then they push their costs down onto the private payers. So we have a circumstance in America where, let's just say if you go into a gas station, it doesn't matter if you're a doctor or a lawyer or if you're on welfare, you're going to pay the same amount for a gallon of gas. But in the healthcare industry, it's different. The charges have been shifted over to the private payers. Government thinks they kept healthcare costs down because they use their bargaining leverage to drive their costs down, but they've shifted those costs over onto the private payers. And I think that's a root cause here that's been almost not discussed at all across America.
All right. Now, Congressman, we have some members of Congress from the Democratic side who say they want a single-payer system. Barney Frank is on the record as saying that. He wants Medicare for everybody, as he puts it. We have Nancy Pelosi alluding to the same thing. Do you think that members of Congress are going to be the one to put forth a single-payer system that does crowd out private insurers altogether, and then the president will follow?
Well, I believe the president is for single payer too. He just hasn't been as open about it as some of the members of Congress like Barney Frank or Nancy Pelosi. I believe that is their end goal. So I would pose this question, and I think they'll get there if we don't stand in the way. But what are we trying to fix? One thing is our health care is too costly, and yet the president said yesterday he'd refused to address the issue of the high costs of litigation. And then the other thing we're trying to fix is around 44 million Americans that are uninsured. If you take out illegal aliens from that list, and if you take out those who are just temporarily uninsured, the chronically uninsured in America number about 4%, or 10.1%, or excuse me, 10.1 million chronically uninsured. Now, if we would just provide full deductibility for all the health insurance premiums for everybody in America on the same standard, I think we'd come a long ways towards closing that gap. But 4% isn't an alarming number when you think about it in those terms.
All right. An Iowa Republican is joining us with his view. Steve King. We had expected a Pennsylvania Democrat, Allison Schwartz, to be with us as well. She had to vote on a very important issue. Hopefully she'll be back before the end of this hour. Steve King, thank you very much for being here. Appreciate it.